Thank you, everyone, for joining us tonight. I'm Julie Lindo, Associate Director of San Francisco Bay Physicians for Social Responsibility. Tonight's webinar is titled Recent Studies on Health Harms of Air Pollution and Benefits of Building Electrification, with Dr. Bret Andrews, SF Bay PSR board member, and Brady Seals, Director of Electrification for Health at Stanford University. And now just a little bit about SF Bay PSR. San Francisco Bay Physicians for Social Responsibility unites the power of medicine and activism to protect life, confront the greatest threats to human and planetary health, and empower communities to build a safer, more just, and sustainable world, all while safeguarding and strengthening the democratic rights crucial to achieve these protections. We hope you will stay connected with us via social media, our newsletter, action alerts, by becoming a donor or joining a committee. We will post info in the chat. And now it's my honor to introduce our first presenter, Dr. Bret Andrews. Dr. Bret Andrews is an SF Bay PSR board member and a former associate chief of neurology at Kaiser Permanente, Oakland, where he now works part-time. He focuses primarily on advocacy for climate health policy and presents to physicians and policy leaders on climate health. He is also a co-founder of Niche, neurologists interested in climate and health. As our presenters speak tonight, please post your questions in the chat. We will have a Q&A when both presenters are finished. And now I hand the mic to you, Dr. Andrews.
Thank you, Julie. I'm going to share my screen. So, hello, everyone. It's a pleasure to have you join us tonight. We will be presenting the research on the health harms of air pollution and the exciting potential benefits for health and safety of going electric, as well as how we can get there. We celebrate and support the continued progress of the Bay Area Air Board towards rolling out new appliance rules for electric water and space heater replacements, as they will be meeting May 6th. A host of new research has come in the last few years since these rules were first proposed, and this research even more strongly supports the health benefits of abandoning gas appliances. Brady Seals will be presenting very new research hot off the press as well. And we're encouraging you to please support the strongest rules from the Air District by signing our letter to the Air Board if you have not done so already. So in 2023, the Bay Area Air District initiated first in the nation amendments to their rules 9.6 and 9.4 that would phase out gas, water, and space heating appliances as they fail. And these would require no nitrogen oxide emissions. So this would mean electric and even better heat pumps because they're more efficient. So our goal is to support the Air District to stay on track to implement with making reasonable adjustments or exceptions for affordability or extreme structural challenges, both for social justice and for the limitations that might exist. So not gas stoves. This is basically the appliance rules are not for gas stoves, not gas, other gas appliances, and nor for propane. So only when gas-fired appliances need replacing. And these flexibility exceptions that the board is pursuing would protect lower-income families and outlier cases where installations would require expensive home renovations. Our organizations and communities that are collaborating on this effort support programs in the state that will help to help fund the lower income families and social justice. So most homes will not need electrical panel upgrades, and upgrades should be for conversions to these non-gas appliances would be 1 to 2 days to replace. And if the power goes out, there's a tank of hot water, and it's becoming more easy for battery backup to supply long-term power outages. Costs are coming down. Heat pump sales exceed gas furnace sales in the US, and they're better quality and higher in energy savings. So the Bay Area Air District is expecting maybe up to even 38% exemptions, but this will still provide profound health and climate benefits. Why is or are appliance electrification and a health and climate necessity? The fossil fuel air pollution has substantial health harms directly through PM 2.5, which is these small particulates like this, about a 30th the size of a human hair, and these are basically soot that's collecting. As well, invisible gases like nitrogen dioxide, ozone, and volatile compounds like benzene. As well, air pollution indirectly causes health harms through climate change. Carbon dioxide, methane, and ozone promote the climate change as greenhouse gases. So outdoor and indoor air pollution from gas building appliances primarily comes from nitrogen dioxide, much more than PM 2.5. And residential buildings emit more nitrogen oxide gas pollution than passenger cars, industry, or refineries in the Bay Area. Nitrogen dioxide can increase ozone or generate PM 2.5, and Brady's going to talk about this a bit in a few minutes. So, gas burning building appliances include stoves, water heaters, furnaces, and all these other gas appliances like clothes dryers. But their pollution all eventually ends up outside effectively. But water and space heaters vent pollution directly and contribute most of this building pollution. Residential indoor air pollution mostly comes from stoves venting indoors, but also comes from air pollution seeping in from the outside. And since we spend up to 90% of our time indoors, this could be a significant exposure in our homes, which can be additive. Just a little bit about air pollution and air quality. We hear about the air pollutions in the green range and so forth intermittently. And what this is this is a scale which is translating the PM 2.5 concentration into a number or a color. And so what is safe? Well, the EPA is saying 0 to 50 is good, 50 to 100 is maybe pretty good. But actually, the new data is not supporting that it's this simple. In fact, some long-term exposures to high good range may not be safe. So in the moderate range, susceptible populations could easily be affected rather than in what the EPA says in the orange range is unhealthy. So it's good for us to be aware of these air quality indexes and try to modify for our safety and our patients and those in our community. You can look up the air index through purpleair.com or even the Bay Area Air Quality Management District, our air district, shows hourly air quality index from all sorts of communities in the region. Here's a purple air shot from a month or a month and a half ago. And what people don't realize is that we've had bad air on a lot of days, for days to weeks at a time, in recent months. And it's kind of just a little bit of haze, but it is could be significantly affecting our health. These numbers are going up into the 150s range. And the reason this occurs is because sometimes the wind that blows through and gives us clean air and blows all our pollution away toward the Central Valley stops, and that's called the marine inversion layer. So when that's happening, we are getting all of our own bad air sitting there. So we definitely want to be aware of this, and unfortunately, it's not so well publicized. So following it is probably a good idea. Uh, the health harms that are relatively new that studies are telling us are several levels, and I'm going to go through these in a little bit of detail to give you some information about it. Um, Recently, as in recent years, we have found more evidence. We already knew that this PM 2.5 or particulates were bad for lung health, heart and brain health, and neurological health, and that they were harmful. But we're now learning that nitrogen dioxide, which is from, heavily coming from our buildings, is also similarly associated with those same health problems. As well, we're learning more about the health harms in general linked to air pollution, more of them, and that they're potentially affecting systems throughout our bodies. And now we're also learning more about the health risks to children, people of low income and color, and other vulnerable communities. So I'm going to go into a little more detail about that. Let's talk first about the risk, excuse me, to, I'm going to make sure that I don't lose, sorry, I'm dropping off for a half second, but I've got my power well generated here. Um, the what we're finding with that nitrogen dioxide being of more risk is that high doses in short term or increased long term can produce more asthma, chronic lung disease, stroke, dementia, premature death, um, and heart problems. And these are especially affecting vulnerable populations with chronic disease, the elderly, children, and pregnancy. So here's an example, nitrogen dioxide in the short term. And a meta-analysis is a big study. And when you get a lot of data together, you have more power and sensitivity. Short-term jumps of less than 5 days increased risk 28% and 15% for PM 2.5. So that's 28% for nitrogen dioxide. Relatively new information. And I do want to emphasize when we talk about studies, one study does not mean proof. What we're doing is looking at a lot of studies and saying, okay, we're getting evidence now that this really does support stroke is linked to pollutants like nitrogen dioxide. A meta-analysis also showed nitrogen dioxide connected to dementia, that there's an increased so-called hazard ratio. And this is also true for PM 2.5, which we've already known. These studies are also showing more extent of air pollution effect. So we didn't know this, but we're connecting it with other things than what the Air District has been emphasizing or looking at. They've mainly focused on asthma, respiratory conditions, malignancies. Whoop, this is a little misspelled, sorry. Neurologic, heart attack, stroke, lung cancer, and premature death. They kind of have these categories that they've been following. But there are more categories that we need to be following as well. And as well, the research is also finding more risk from wildfires, pregnancy in children, and people of color and low income. Let me go into a little more detail on that. So Parkinson's, 56% more risk of Parkinson's disease for people that were exposed on a long-term basis to an air quality of just 40. And you remember how I said that's the green range, right? So that's compared to people of the lowest exposures where they had really good air quality down below 10. So that is an increased potential risk. This was a large Medicare study of looking at the whole United States, and several meta-analyses, other studies are also showing that effect. So it's becoming pretty convincing connection. How does health harm come from air pollution? Well, there's two paths. There's the direct pollutants that we've been talking about, and also greenhouse gases indirectly are affecting climate change, which affects wildfires, and then is coming back on us as a health harm. So uh, air pollution is the source of both direct and indirect. The health challenges from air pollution are now amplified by increased contributions from wildfires. And now, even greater, we're looking at emission standards setbacks from the EPA and reduced support of federal programs to provide expedited pathways for electrification. So we're under a lot of challenges, especially from the winds blowing against us federally. But really, the essence of this boils back to what's on the left. The air pollution is something we can directly affect on a more local and statewide level. So that's where we have to be really focusing long term and in the short run to benefit our own health. We do know that the US and Canadian wildfires, this is the US in the Western United States and especially northern Canada, are getting bigger and more frequent and more serious. And that's producing a lot of wildfire smoke. It's estimated that over 40,000 people die a year in the US prematurely due to the PM 2.5, those particles from wildfires. And that's expected to rise another two-thirds by mid-century at this rate. So we can reduce the pollution by electrifying our homes, appliances, and cars. We also are seeing links with pregnancy and children and air pollution that is new. So we've known that there's likely an effect from low birth weight, but now that studies are just coming in and really proving this point that PM 2.5, a meta-analysis, for example, big study came out in 2024 of increased odds, and then 6 studies in 2026 alone are showing that connection. We're also seeing even connections with cognition for children linked to PM 2.5, lower IQ scores related to exposure. And this is especially true for children. The pollution affects them because they have higher breathing rates. Their lungs have a higher portion relative to their body, so they can absorb that pollution more. And we're seeing other connections like lung development, the increased asthma, behavioral changes, and even a potential mild autism link. This is not a driver of autism, but it is a potential mild association, and other brain structure and function effects. So now looking at our communities, what are we up against? We have environmental injustice. We have increased air pollution and multiple other factors adding up for vulnerable populations that live near heavy air pollution sources due to environmental racism and redlining economic policies. These communities are near highways with trucks, refineries, airports, and so forth, and industrial pollution at a higher rate than those in other parts of our Bay Area. And these social and environmental determinants of health are additive. They suffer the stress of racism, low income, safety problems, food choices, increased noise. It goes on. And so they also often have homes that are smaller, so they're getting a higher concentration of indoor air pollution with older appliances lacking ventilation hoods to get rid of that nitrogen dioxide the stoves are generating. So we are seeing new evidence that is proving this point, and we applaud the Bay Area District has been funding research to show these disproportionate effects on a local level. They have mobile air monitors and other studies that they're supporting, which are showing this. And we're seeing that people of color have up to 55% more nitrogen dioxide pollution than mostly white neighborhoods, more than 30% of the regional average, more nitrogen dioxide. And we know that these large air pollution models that they've used for modeling in the past just don't quite cut it. They underestimate these localized nitrogen dioxide effects. And these are where maybe this nitrogen dioxide has the greatest impact. Again, vulnerable members of those communities, children, elders, people with pre-existing conditions, um, pregnancy, and so forth, are especially vulnerable. So we're not looking at with the Bay Area Air Board stoves, but we do want to mention that this is obviously an additive contribution along with outdoor air pollution burden. And so let's talk just a little bit about stoves. The nitrogen dioxide pollution, it's estimated from two gas burners is greater than from gas car idling in your kitchen. And some stoves, if they're underperforming or old, can produce high levels of carbon monoxide. So the pollution from our stoves is invisible unless we're burning something and there's smoke. So, and it's also odorless. So, typical gas stoves are unsafe, um, and uh, they're unsafe. They can produce unsafe levels of nitrogen dioxide and benzene, and actually. Brady's colleagues at Stanford, the Rob Jackson's group has published several papers, and I'm going to highlight some here. So they found this association with high levels of nitrogen dioxide and benzene, even in distant bedrooms for hours. And we know that outside venting hoods, even if they are present, are not 100% and are often even not used, even in privileged homes. So we're all getting some dosing if we're not using our hoods and trying to get rid of this gas exposure. People living in small homes have 4 times more long-term dioxide exposure than people in larger homes. Another Rob Jackson paper. And we know that these vulnerable people among them are also especially vulnerable. We uh, Brady actually published with Dr. Grunwald a study which showed that if we stop using gas for cooking in California, there would be up to 20% less childhood asthma. And Rob Jackson's group found that frequent stove use doubles a child's lifetime benzene cancer risk. So moving to all electric appliances would stop countless emergency room visits, lost days of work and school, and other health harms, reduce that asthma and other exposures. Uh, the Now flipping back to the district had estimated some benefits back when they published the initial rollout of these appliance rules changes. And they're a little out of date. So on their website, they're quoting these same numbers that are probably developed a few years before they actually were published. But they were saying only up to 85%, or I'm sorry, 85 premature deaths would be benefit or stopped by going to eliminating heat pumps and water space heating. I'm sorry, eliminating gas, water heaters, and space heating and switching to heat pumps. But there was a study which showed an estimated 2,500 premature deaths from nitrogen dioxide. They were using very sensitive modeling. And Brady's data, which he's going to talk about more, suggests that more premature deaths would also be averted based on their recent nitrogen dioxide studies. Um, the Air District also quoted in 2023 110 new cases of asthma annually and saving $189 million. Well, what about in 2026 dollars? I'm sure those numbers are up from that. So, um, how can we protect ourselves? Uh, we can reduce outdoor exposure. Um, we would recommend considering a little bit more aggressive protection than what the air quality index ratings might suggest, especially if it's getting into the orange range, avoiding exercise and excessive exposure outdoors. And outdoors, uh, since it comes indoors, we should be filtering indoors because the air pollution is coming in. Um, and preferably, if possible, a HEPA filter running in the rooms that people are in if it's a red flag day or at least an orange day. And if for pregnant women and those with histories of these vulnerable populations that have had heart attacks, strokes, lung disease, or have cognitive impairment, maybe they shouldn't be wearing a mask outside when the air is quite bad with one of these valves so that it's not difficult to wear the mask. And potentially even if someone's living right next to a freeway or some very high pollution, trying to relocate with family or any way to avoid that high dosing of pollution. Um, we can also reduce air pollution. We can reduce air pollution through the gas appliances um, in our kitchens. We can open windows. We can turn on the hood fan. We can cook on the back burners. This is if we have to use a gas stove. But if we can, let's use electric appliances. We have microwaves, tea kettles, air fryers, Instapots, and so forth. And moving toward induction stoves, if possible, is also recommended. Here's actually Julie's stovetop with her induction cooktop. And so you can get portable induction units loaners through a PG&E program, and some libraries are doing that as well. If you're cooking really high heat, sautéing stuff where you're going to see smoke, the HEPA filter will potentially help. HEPA filters are good for the particulates, but they don't really eliminate the nitrogen dioxide because that's a gas. And that you need very special filters to get rid of the nitrogen dioxide. Um, so we can reduce air pollution on a bigger level here, not only by working in our own homes with the kitchen, but replacing potentially the appliances, the water heaters and stoves. And then we can reach out to electrification services and create a free home electrification plan and start implementing that plan to move toward more electric. We can ride public transportation or ride electric bikes, drive electric cars, advocate for equitable electrification programs that prioritize vulnerable communities. And to learn more about this, you can sign up for the San Francisco Bay PSR action alerts to learn about upcoming advocacy. And Julie's or the group's putting a link in the chat for us. For the Air District advocacy, we're looking at the board meeting next Wednesday, and we're asking folks who haven't signed to sign on to this health focus letter to get to support the Air Board in moving forward with these new rules. As well, if you're motivated, you can join in person at the Air District meeting, and you can sign up with us, a link in the chat for that, and we will help you with talking points. Please use this QR code if you'd like to sign the letter, and we really appreciate that. We want to thank our Bay Area Clean Air partners and other partners that we collaborate with on this effort. And there are more than we can name on the slide here. Please do look at these links if you're interested. Um, I just want to emphasize, I will make the slide show available to anyone who would like it. There will be a link available for that. And the home electrification resources, we thank our local cities and counties and community energy providers for offering renewable clean energy and support for residents to electrify. There's many home electrification resources, and we encourage you to look into these. These are not endorsements, but ideas, and they will help you create a reasonable plan for home electrification. The San Francisco Climate Equity Hub is collaboration of aid justice organizations and SF Bay PSR. And we also thank the San Francisco Environmental Department for their support. The links are in the chat. I'm going to wrap up now and pass the baton to Brady. And I'll be happy to answer questions at the end of the talk. Thank you very much.
Thank you so much, Brett. I'm that was absolutely every time I learn something, every time you give that talk. And everyone, I posted a lot of links in the chat. So please, I know there's a lot in there. Don't worry if you miss something. We're going to send out a link to the recording and we will include all those links in our follow-up email. But I should say, if you want to sign on to the health letter, you should do that tonight because we will be submitting that tomorrow. And I'll post the link to the letter one more time in the chat in case you can't find it. So it is my great pleasure and honor to introduce Brady Seals. Brady is the founding director of founding director of Electrification for Health. I absolutely love her new title. It is a new program at Stanford focused on improving health outcomes through the adoption of clean electric systems that reduce indoor and outdoor air pollution. In this role, she provides strategic leadership for the program and oversees work across research, policy engagement, and external partnerships. Prior to joining Stanford, Brady spent nearly 6 years at the Rocky Mountain Institute, RMI, where she led a team advancing evidence on the health and air quality benefits of highly efficient electric buildings. Earlier in her career, she worked internationally on household energy access in the nonprofit and private sectors with experience in 15 countries, including as a co-founder of a startup. Her work has been cited and featured in more than 100 media outlets, including the New York Times, the Washington Post, NPR, CBS, and the Samantha Bee Show, just to name a few. And now I am absolutely thrilled to introduce Brady Seals. Brady, I hand the mic to you.
Wow, Julie, thank you for that very kind introduction. I just want to say how excited I was to have this introduction to be here with you from PSR, San Francisco Bay Area. When I started working on buildings and electrifying buildings about 6 years ago, you all were really one of my first health partners, and I continue to feel that you are some of the best of the best. I think your ability to make change, to organize, and just all that you do. Thank you. Thank you, Julie. Thank you, Brett. Thank you to the whole team. And thank you to all of you who are here with us at 7 p.m. on a weekday. It's really all of you that make the change happen, and this is the change that we know will have immediate health benefits to people as well as climate people. So you're doing the work. We can't do it without you. I wish I could give you some good news after Brett's presentation, but I'm going to give you, some more of the air pollution and health news from just 2 other studies. But what I really want to do in my time is talk about a new study we have coming out, give you all like very much a sneak peek. I have a new student research assistant who was helping put together Bay Area stats up until I think 5 p.m. today. So fresh data. And if we have time during the Q&A, I would also love to get your take on how can we give you this data, what's most useful. And I just love seeing some of these names in the participants of people I've met and people like Barb here at Stanford that we're hoping to do a lot more with. So without further ado, let me quickly share my slides here. Hopefully you can see that okay. So Julie said this, but we have a new program. We're 6 months old. We are called Electrification for Health. So nobody can mistake what we're doing here. And we are in the Center for Human and Planetary Health, which is in the Woods Institute here at Stanford, and really bringing together all the climate and environment work with the med school. And it's super exciting to be part of this, to get to scale this work. Our vision is clean air and power for all. And our theory of change, or how we think we can make this change in the world, is that using research, policy, and partnerships like with you all, we can make this change from burning polluting fuels to electric appliances. And at the end of the day, that's going to be healthier people and the planet. Just to give you two very small anecdotes, I'm working here with Rob Jackson, who Bret mentioned, and Bret has testified with him before, but Rob is one of the top 5 most cited climate scientists in the world. And so he won the Blue Planet award last year, which is very prestigious. It's sometimes called like the Nobel Prize for the environment. And he donated his prize money to start this program because he felt like from all of the climate work that he's done, nothing has made more of a tangible impact than when it had the health framing. So I think this work that you all are doing, the reasons why you're here, is so important. I'm thrilled that Stanford matched Rob's gift and we get to do this program here today. And we're new, and we want to make sure the work we're doing is valuable in making that impact. So I'd love feedback from you all later on how we can best support and add value, not reinvent the wheel, for your campaigns. So I just wanted to talk a little bit about 2 studies. This is a lot of text, but 2 studies came out. This one came out in December 2025. This was from Rob, again, here at Stanford, and PSE Healthy Energy. It was really the first analysis that looked at all this NO2 outdoors and indoors, a lot of what Bret talked about, and saying, what if you put it all together? Like, what's worse for you? And it turns out it depends on where you live. So this is what we call the zip code study. Basically, what we find that if you cook a lot, like more than 2.5 hours a day, more than half of your NO2 exposure can come from your stove indoors. And if you cook for 35 minutes a day, it's still about a quarter of your total NO2 exposure is coming indoors. This gets very interesting when we think about what does this mean for the US? So if we average this across the entire US, including the about 60% of people who already cook with electric stoves, we found that gas stove use accounts for about 10% of people's total NO2 exposure. So at the population level, it just shows us that this is a big deal. This is an indoor source, often not counted, hard to measure, but it's a big deal. You can check it out by the zip code. Unfortunately, it's behind a paywall, but the Washington Post made this into like a nice thing where you can type in your zip code. It will tell you, and how much you cook, it will tell you what your exposure is. But the bottom line is that if you cook with a lot and you live in a polluted area, that can easily bump you above what outdoor World Health Organization benchmarks of 5 parts per billion for NO2 are. So that was one new study, and then just one quick one I want to talk about. And sorry, I think I have the date wrong. This European benzene study just recently came out at the end of March. But PSE and Stanford have been going and taking samples Like it's pretty wild, but until the last few years, we actually did not know what was in gas. Like, let's just have that sink in because I found this shocking. Until a few years ago, we didn't know what was in our gas and how that differs from city to city. So there's been this massive study to go and sample, and you basically just take a little tube and fill up what's coming out of someone's stove and send it to a lab for testing. And the findings in the US were that there's a lot of benzene that's just in our gas. And unfortunately, about 1% of all of the gas that's delivered to stoves, tankless water heaters as well, leak. And when that leaks, benzene is leaking with it. And benzene is a known carcinogen. So just recently, the researchers went to Europe, to the UK, Netherlands, and Italy, and they actually found that the levels there were 10 to 70 times higher than what's in North America. So what this is showing us is that gas is like some gas is dirtier than the others, and it appears to be that the gas coming from Europe is, and the North Sea in particular, is dirtier than what we have here. Interestingly, Russia kind of latched onto the study and did a lot of promotions trying to promote Russian gas after this came out, which is just like an interesting take on the times that we're in. But similar to the US, the researchers found that in about 40% of the homes, the gas leaked. There's no safe level of benzene exposure, but these levels are high enough to exceed an EU, what the EU has annual limits in about 10% of homes. The other surprising thing is that the average person cannot smell these types of leaks. So all of us smell differently and have different sensitivity, but for the average person, the odorant, the chemicals that they put in there so that we can smell this, it would need to be 40 times higher for someone like me or you or an average person with average sense of smell to tell that there was a leak. And outdoors, they were able to see a leak, and they found that the high benzene levels, this leak went undetected for about 3 months and was only noticed by a satellite. So the satellite picked up the leak, the researchers were able to go in, and they found super high benzene levels. So one thing that came out is that the workers who are sent to fix these leaks are exposed to this benzene. And then because of the way the wind was blowing, the benzene was affecting people and communities downwind, that for 3 months. Luckily, this was detected, but many leaks go undetected. So the benzene, so we've talked a lot about nitrogen dioxide, carbon monoxide. I think benzene we're learning a lot about. And I'll just note that here at Stanford, the pollutant we think is kind of at the next frontier is ultrafine particles, even smaller than PM 2.5 that can penetrate deep into the lungs and even cross the blood-brain barrier. So Rob Jackson and his team are looking at what the ultrafine levels are from gas stoves, and yeah, I can just say that it's not good. So we'll have some more coming out about that, and then the next study that will be coming out soon from PSE and others will be on restaurant workers. What is the restaurant worker exposure to these pollutants? So a lot more to look forward to in terms of building the evidence base. And again, these are stoves. If anyone would love to be a beta tester and give us some advice on how these websites can be used, what format is most useful, this project exists to use health and air quality evidence to inform policymaker, and you all are the experts. Please let us know how we can be helpful. I hope this sneak peek was useful. I'm here as a resource and really looking forward to working with many of you in the future. And I'm going to stop now so we can have lots of time for healthy Q&A and discussion.
Thank you so much, Brady. I know also when we send out the follow-up email that we can ask these questions of people in that email and collect even more feedback for you about the fantastic story map tool. We do have some questions, so I think I'm going to go backwards a little bit because we just were talking about you were just talking about the story map, and I just want to share with you that um, Carol suggested that infant mortality rates would be useful, and Leslie said that another level might be the trend of adoption of all electric installations and rental challenges is huge, from small 3 to 5 apartments to larger apartment buildings, as well as SFH rentals. Let me look here. Rewiring America would be probably interested in beta testing. Leslie from Act Now Bay Area would be interested in helping. Oh, and Leslie says also it would be very interesting to look at single family homes as well. So let's see. I'm just reading through some of the Carol asks, what technologies are being used to map the NO2 directly to specific sites? Last week, Climate Week, I saw a demo for methane tracking, which tracks directly to a factory or a field to show direct linkages in the terms of consequences and harms.
Thank you for the question, Carol. That's a great question. I'm wondering if what you were looking at was maybe the methane risk map from PSC Healthy Energy, which is using satellite data to go and track. For this project, we're using the EPA emissions inventory. So this is what the EPA emissions inventory that they use. So we're inputting all of that data and all the precursor data into CMAC, which is a sophisticated modeling tool, and then that's getting spit out, and then we're using BenMap R, which is the health modeling tool. So it's a lot of modeling on our end, not using satellite, but using the EPA data.
Let's see, we have another question from Dr. Barb Ernie, one of our who gave a wonderful talk last week for us on plastics and our health. Check out the recording; it's on our YouTube channel. She asks, how do these new risk levels compare with those programmed into the EPA Cobra tool that the Air District used to calculate health benefits for their gas appliance rules?
Great question, Barb. And I can follow up with you with the exact information. Boston University, led by Jonathan Buonocore, has been the one doing the health modeling. I think this incorporates a lot more of the precursor pollutants than the Cobra tool, and I think that's where we start to see more, or like the greater numbers, but it's a great point and one I'd be happy to follow up with.
And I apologize. I think that question may have been from Gerard Manning. Sorry, Gerard. But Barb does have a question. Is the NO2 eating the ozone layer in the stratosphere or the ground level ozone, or both?
Interesting. I better just say I don't know, and I will check with Sarav Arunchalam, who's our University of North Carolina expert on this. So I will get back on that point as well.
Great. And could you explain more what components actually leak from a gas stove when it's off?
Yes. So the Stanford researchers found that about 1% of all of the gas that's delivered to a stove leaks as unburned methane. And so whatever is in that methane, in that gas, is also being leaked. And so when I mentioned before about how until recently we didn't really even know what was in gas and how it differed, that means anything else that's in there is leaked. So there's I think they identified about 200 different toxins and chemicals. BTEX is which is benzene, I think is the most potent and the most well known. That's where we say like it's the benzene that's leaking out. There are a number of different elements, but that's probably yeah, the one of the most well known and one of the most concerning from a health perspective. And the other concerning piece is that the Stanford researchers often would place like a benzene, which is emitted when it's burned, but also when leaking. They put benzene sensors in the kitchen, in the living room, and then in the furthest bedroom from the kitchen. And overnight, like they found high benzene rates in the bedrooms. So that's one concern about the methane that leaks even when the stoves aren't on, and then these toxics that are leaking out with it because they can potentially stick around for a long time.
Wow, 200, 200.
I believe so, and I can link some of those studies that found the whole, it's called their gas composition, everything that's in gas. It varies a little bit depending on where your gas is from, but it's, in general, the categories are similar from city to city.
It's amazing. Um, and Brett, I don't know if you have this handy, but there was a question. What is that shocking stat that you mentioned? If you have two burners of gas going on the stove, it's equal to a car exhaust in your kitchen.
Yeah, it's related to basically estimating an equivalent amount of burning fuel. Now, of car fuel and fuel from the natural gas fuel are different in composition, but and cars do have catalytic converters, which reduce their nitrogen dioxide and carbon monoxide production some. But basically, it's similar running two burners as idling a car in your kitchen,
Wow.
you know, or smoking, secondhand smoke. These are kind of comparable, although not apples and oranges, somewhat. Yeah.
Dr. Michael Geschwin asks what the valves on the K95 masks. Could you explain why you recommend the valve ones?
So as we know from COVID, elderly people and people in general just struggle to wear masks out, for periods of time, especially if it's uncomfortable for some more than others. The valve masks are much easier to wear because you're not struggling against the mask itself. You're breathing in, the air, and you can easily expire that air out of the mask. And so it's a much easier to wear for periods of time, especially for people who, want to pull the thing off almost if it's not, doesn't have the valve.
We have another question about, and Gerard answered it partly, but is there maybe either one of you may have something to add to this? Is there any concern about health data coming from the EPA and other government agency sources? We're hearing so much news about the deep funding cuts happening and to important programs and staff.
Well, clearly, I'm sorry, Brady, did you want to?
Go ahead, Brett.
I mean, definitely the EPA is taking down information, and I think people have been struggling, researchers, to protect that information. But the details I'm not very familiar with.
That was going to be my exact point. I think the biggest worry is taking down and removing a lot of the tools, like the Justice 40 tools. A lot of some of the stuff that we're using with this Cal virus screen, where we're able to do these layers, are disappearing. And I don't want to call it like a black market because that's not what it is, but there has been a ton of researchers who have downloaded these before in anticipation and have now uploaded them to different places to try and preserve them. So I think by and large, the academics I've talked to have not been worried. They think it's still there and being preserved, but I think there is a fear of when will it be back? And I think the bigger fear is just like this losing trust in science. And that's maybe a communication and something we all need to figure out or or work on is how to bring more trust back into the science.
Yeah, for sure. Um, Question about gas fireplaces. Do they leak? Do we know if they leak in a similar way as gas stoves?
I can just share a personal anecdote to this because my parents I got them to change out their gas stove, but I had a lot of trouble on the fireplace. So, and my mom has lung cancer, and so I really struggled with what's worse, a wood burning fireplace or a gas fireplace. Um, and at the end of the day, I think that for her and for my family, the gas fireplace that was highly efficient and well vented to the outdoors was better for her than the wood fireplace. So just to say, I think you didn't used to have to vent gas fireplaces, which is wild. And there are studies on that. Now, by and large, building codes, you do have to vent gas fireplaces. And I do think you can get a highly efficient gas fireplace that vents outdoors. But just to share that this was a really hard decision for me and for my own family on what's worse, a wood fireplace or something that uses gas but feels tightly controlled and contained and is vented outdoors and has really no open areas.
Thank you. And that was a question from Dr. Margie Shen. Thank you, Dr.
Just
Shen.
an addendum to that, in the
Yeah.
Bay Area, wood burning is the leading source annually of PM 2.5. So wood burning is really bad and it has a lot of particulates compared to the emissions from natural gas. Yeah.
Aren't there are stoves that I don't think they get warm, but I mean, fireplaces, they don't get warm, but it's like a water vapor type. It looks like a flame. Yeah.
I think so. Yes, yes,
For
yes.
another
So
night, maybe.
for our next webinar.
Yeah. Okay, let's see. What a question from Dr. Mike Martin. What efforts are being made to directly educate the public about the dangers from gas stoves? Well, here at SFA PSR, we do a lot of outreach. I put our handouts in the chat earlier. I can do that again. And if you visit our website, you'll find lots of helpful information, not only about health, but also about how to electrify your home and lists of research studies that you can read on your own. But Brady and Bret, you may want to fill in more information. You guys do so much work in this in educating the public.
I'll just share an anecdote, which is that some of you may remember Climate Nexus was a strategic communications shop, and they used to do an annual poll on people's perceptions on gas. And now they've been doing it for 6 years. And although Climate Nexus has, is no longer, there's a group called Gas Leaks that's continuing to do this poll. And something very interesting that they found was that the number of people who are aware of induction stoves has increased like 19 points, which is a huge jump over the last 16 years. Um, and it's incredible when you look at the data from year to year. Even though there's been a culture war on gas stoves and everything, it's working. People know about it. So we've already made some progress. But then when you look at the data of how many people have ever used an induction stove, it drops down significantly. And in particular, the data showed that for older people, they hadn't heard about induction. So younger people and Democrats had heard about it. But I think from my read, what this showed is we have to keep up what we're doing. We have to try to reach older adults in particular, and then have to find some way to get people access to trying induction or seeing induction in someone else's home.
I love all the videos by top chefs about how much they love induction. Um, let's see, I'm just looking for some more questions here. What is the average cost of a heat pump for a home, 1,000 square feet? Well, I want to first add before that question's answered that um, one of the important things to remember about these air district rules is you don't have to replace your gas appliance until it burns out. And when it burns out, you would be paying for a new appliance anyway. So the cost difference is the difference between how much it would have cost to put in a gas appliance and how much it costs to put in an electric or not zero NOx emission appliance. I want to point that out because there's a lot of misinformation out there right now about the costs. And I think part of that misinformation is that people are not looking at the difference between. Yes, thank you, Leslie. So I don't know the average cost of a heat pump. Does anybody in the audience want to answer that in the chat? Is there? I don't know if our guests know it either.
I I just looking on a quick search. They're giving estimates of about 3,000 to 7,000. So of course there are more expensive options, but 3,000 to 4,000 might be a reasonable guess
Yeah, that's what
per
I've heard
thousand.
to put in a really good mini split is about 3,000 for a really good mini split. I so and I also want to add that because of these rules, they're driving innovation in the manufacturing realm, and there are more there. I feel like every week I'm hearing about a new innovation in a product. They're becoming 120 volts. You don't have to put in new wiring. You can just plug them in. They're becoming smaller, more affordable, more efficient. So it's really important the way these rules are driving the innovation and bringing down costs on the manufacturing side. There's also a lot of work being done to train contractors, and it's a really our contractors are learning how to do these installations, and those costs are coming down as well. Thank you, Kelly. Kelly confirmed that those were correct numbers for mini split cost. And Kelly's from Rewiring America. She says central ducted heat pumps installed by a professional can range from 10,000 to 20,000, but an AC furnace install isn't much different. So again, back to that point that the difference between the gas appliance and the heat pumps, sometimes the difference is not that great. I also want to point out that heat pump sales in the US exceeded gas furnace sales across the United States. So this is not a political issue. This is really an issue of heat pumps work better and they provide cooling as well as heating. So you get a 2-for-1. So there's lots of really good reasons to look at heat pumps when it comes to cost, value, efficiency, comfort, health, many, many excellent reasons. Margie Shen writes, the restaurant lobby, especially Chinese restaurants, were in big opposition. Is there a data about exposure and the health to restaurant workers? I do know there's a top chef who is a Chinese chef or Chinese American, and he is developing a really good wok that can be used on induction cooktops. So I know that's kind of another issue, but which is culturally sensitive cooking, and I know there's a lot of work being done to make sure induction can meet the needs of different styles and of cooking. Chef Martin Yang, yay! Thank you, Leslie. But I think Brady, you mentioned you're working on that data, right? Or do you want to?
Yes, there are two studies that will be coming out. One is from PSC Healthy Energy that's looking at restaurant workers and the exposure. One not slightly complicated thing, but unlike homes, restaurants have much stricter ventilation requirements and standards, but still it's been many years in the making. We will have a study that looks at that, and then there will be another study coming out from NYU that's on restaurant worker safety and New York City and specifically looking at biomarkers, urine and blood of restaurant workers. So I think it's really key to get them on board. Just to give an example, Stanford is having this big sustainability forum that I was at today, and Chef Jose Andres, if some of you know, who's there, who's such a leader in clean cook stoves abroad, but his group opposed the all-electric Palo Alto building code because they wanted their restaurant to be able to have gas, and they said they couldn't cook without it, and they ended up winning. This was many years ago, so I was trying to find him. I didn't yet succeed, but just to reiterate, I think this is a really key point and something that we have to keep on keeping on by both looking at the worker safety angle, not just from the air pollution, but from heat and others, and also just all the benefits of electric cooking. Just one thing I've heard from Chef Chris Galarza, who some of you may know, who has a new certification program. Like a lot of chefs go through their whole certification, never have tried induction. So trying to get that built into the curriculum, which is very common in Europe and other places. And so I think that trying to address this from multiple angles will ultimately benefit the movement in the end.
Yeah, I always think about how we banned smoking in restaurants and bars to protect the workers. But if you think about how much exposure chefs are experiencing over a huge gas stove, and yeah, it's pretty frightening to think about. um, Let's see. Stephen Jackson writes, one problem with gas versus electric stoves is that renters have no power to change the status quo or the type of replacement when that becomes necessary. It would be good to look into how to persuade landlords to choose the healthier option if the cost difference is not significant. That is a really good question. I just quickly want to point out that I am a renter, and the photo that Bret showed earlier is just one way that renters can get around having to even ask their landlord, which is I bought a slab of marble, I put it over half of my gas stove, I bought a $65 induction cooktop, and I primarily use that induction cooktop to do most of our cooking. Sometimes if we have more people or I need to make a something on higher heat or big pot, sometimes I will still use the gas stove. I'm always careful to open all our windows. But so that's one option for renters. There are also a lot of smaller heat pump models that can be installed simply by plugging them in and putting them in a window. And there are more coming out, being developed. And then I agree, I think we need more information and more ways to persuade landlords to make the switch. Leslie put in the chat that there is a PG&E loaner program. You can borrow an induction cooktop. There are also some libraries that I've heard about. I don't know which ones, but I've heard about some libraries in the Bay Area will let you check out an induction cooktop as if it was a book and then borrow it for a while and test it out. And I love it. People are putting lots of great information in the chat. Brady, Bret, do you want to add anything to advice for renters? It's definitely something we are working on and we'll be providing more of. But I think Bay Rent has some good renter advice too. An SF environment. I'm going to look. San Francisco environment, I believe, has some renter advice as well for landlords. Let's see. Any more questions? Great. Thank you everyone for sharing all this great information in the chat. Oh yes, churches, synagogues or places can decarbonize. Great. Well, we are coming close to time. Does anybody have any last burning questions they would like to ask? And if you think of something in the middle of the night, which is what happens to me all the time, feel free to email us at, I'll put my email in the chat, Julie at sfbaypsr.org. And I will share your question with our esteemed speakers. Great. Well, I love all the enthusiasm in our audience tonight. And I know, I just want to share out that we had 130 people sign up for this event, which tells me there's a huge interest and a lot of people are going to be watching this recording. So thank you to everyone who actually showed up live. It is really makes a big difference for presenters to have an audience. And we really appreciate your enthusiasm and excellent questions. And thank you so much to Brady and Bret for your presentations and all the time you spent on them. We look forward to more collaboration in the future. And I want to quickly remind everybody the Air District's board meeting is Wednesday, May 6th. We are looking for as many people as possible to come. It's from arrive at 9:30. The meeting's from 10 to about 1, though it may go later if we have a lot of public comment, which we hope we will. We need a strong turnout so that just in case there's opposition there, we have a strong health voice to really support these rules. So thank you, everyone. Have a good night.
Thank you, everyone.
Thank you. Bye.
Take care.